Everyone! Welcome back to the channel. Today I'm spilling the tea on whether trying every NCLEX mnemonic in one test actually helped me pass. Spoiler alert, it's a game changer. Let's dive in. First up, we've got fast for stroke symptoms. Facial drooping, arm weakness, speech difficulty, time to call 911. If you remember this, you'll never miss a stroke question. Next, MONA for MI treatment. Morphine, oxygen, nitroglycerin, aspirin, the go-to for myocardial infarctions. Then there's RICE for injury care. Rest, ice, compression, elevation, because nobody wants a swollen ankle. For trauma assessment, ABCD, airway, breathing, circulation, disability, exposure, because in emergencies, airway comes first. Spider-Man for droplet precautions, sepsis, pertussis, influenza, diphtheria, epiglottitis, rubella, mumps, adenovirus. If it spreads through droplets, mask up. The quirky mnemonic, some lovers try positions that they can't handle for cranial nerves. The first letter of each word =, the first letter of each cranial nerve. Smell, olfactory, light, optic. Third, oculomotor. You get the idea. Cold and clammy, =, needs candy. If a diabetic patient is cold and clammy, give them sugar. Hypoglycemia is dangerous. NPH for insulin timing, never peak hourly. NPH insulin peaks at 6-8 hours, so you'll never forget when to check for hypoglycemia. PQRST for pain assessment. Provokes, quality, radiates, severity, time, because just writing pain 8/10 isn't enough. And lastly, all people enjoy Time magazine for heart valves. Aortic, pulmonic, Herb's Point, tricuspid, mitral. Now you'll never forget your heart sounds. Now the moment you've all been waiting for. Did these mnemonics actually work? Drumroll please. Yes, they did. Using mnemonics made me answer faster and remember more. So if you want to pass the NCLEX, use mnemonics. They make studying way easier. And to help you out, I'm giving away a free NCLEX mnemonic cheat sheet. To get it, 1, like this video. 2, subscribe. 3, comment mnemonics down below. Winner announced in my next video, so don't miss it. And remember, no matter how tough the NCLEX feels, you got this. See you in the next video.